Hello and welcome to the Reimagining Rural Health podcast series brought to you by Sanford Health. In this series, we explore the challenges facing healthcare systems across the country, from improving access to equitable care, building a sustainable workforce, and discovering innovative ways to deliver high-quality, low-cost services in rural and underserved populations. Each episode examines how Sanford Health and other health systems are advancing care for the unique communities they serve. Today's topic is a conversation on nursing education and collaborative partnerships in developing the next generation of nurses. Our guest is Dr. Carla Gross, Associate Dean for the School of Nursing at North Dakota State University. Our host is Erica DeBoer, Sanford Health Chief Nursing Officer.
I'm so excited to have you here to really kick off our Reimagining Healthcare and what does it really mean for nursing. So we're going to pull a couple episodes together to really talk about what an incredible gift our colleges are in our states that help to support our nursing practice and the workforce needs that we have.
And we're so fortunate to have practice partners like Sanford. I mean, we could not educate our nurses without a really strong relationship like that. So we appreciate you too.
I appreciate that. Now, Carla, do you mind just introducing yourself and the role that you play, please?
Yes, I am Carla Gross. I am the Associate Dean for the School of Nursing here at NDSU. I could probably tell you a little bit about it. We have two sites, as you know. We have our campus here at NDSU in Fargo, and then we have a site in Bismarck that we call NDSU Nursing at Sanford Health. That was a very careful title that we agreed upon. And so at those sites, we have the pre-licensure BSN program. In Fargo, we admit 64 each semester. And in Bismarck, we can admit up to 56 each semester. And then we also have a family nurse practitioner program that is a doctor of nursing practice degree. And we have that on both sites as well. Amazing. So we admit like about 12 every year in Fargo and 6 in Bismarck. Amazing. And that's face-to-face, just, a traditional taught course, our program, and it's we put out really excellent graduates in that course.
Absolutely. Yeah. We appreciate that a lot. Again, there's also pharmacy here. I had the privilege of walking through your beautiful building and just really saw not only pharmacy, but also other allied health services.
Yes.
As well as public health.
Yeah.
So amazing programs and people that you're helping to contribute to the workforce.
Yes.
And we so need them.
Yeah.
So.
Yes.
Fantastic. Well, obviously, so excited to be here with you today. I love that you're willing to just take a little bit of time to spend time with me and really talk about what and how NDSU is contributing to our workforce challenges, but also getting super creative and using technology to help us address some of the needs that we have as well. So really appreciate that. The hope is really to highlight some of the innovations that we're using to help prepare our nurses of the future, as well as how do we partner as an institution, as well as our colleges of nursing to try to just prepare in this rural space that we live. As much as you're in Fargo, really, when we look at South Dakota and North Dakota and really where Sanford Health sits, it's really rural. And so we have a unique set of challenges that we're really trying to address. So I wonder if you wouldn't mind just telling me a little bit about what your thoughts are on what today's nursing students need to be prepared that's different from in the past. I know you've been part of the NDSU team for a really long time and you've seen a lot of changes in healthcare. Yeah. So I would love to hear your insights on that.
Patients and families are more complex than they've ever been. At the same time, the healthcare system is so complex. So helping new graduates learn how to navigate that is, to me, it seems overwhelming what they walk into, but they are able to do that. And they need to be able to analyze and interpret data and then appraise evidence so that they can give the best care possible and hopefully come with better patient outcomes. And another thing that is so important is that they're able to very quickly assess and adapt to these ever-changing environment. That is so important. And at the same time, healthcare has gotten more and more specialized. So they need unique sets of skills and knowledge more so than ever before, I believe. And healthcare has gotten more interdisciplinary. And nurses are often the leaders on those teams, so they need those leadership skills. And I think our scope of practice has expanded so much, and nurses are more independent than they've ever been. And our students are excited about that. They feel like that's a big challenge. Never before have they needed such high-level critical thinking and clinical decision-making skills. And think about it, now they have to be ready to take care of patients during disasters. I mean, it could have been the pandemic, but it could be a mass shooting or all these environmental disasters that are going on. So there's a lot of challenges in trying to help them develop the skills that they need. And I think we're really realizing how important self-care is. Mm-hmm. It's not just a luxury, it's an absolute necessity. And we have really embraced that. And we start with self-care in our first introductory course. And we also start with learning what professionalism means and what they need to start developing their professional identity the minute they start in the program. So we're really trying to lift them up in that respect. And, you know, I also have to say that never before have we had the mental health issues that we have, not only in their patients and families, but in their colleagues, you know, so helping people through burnout or caregiver fatigue, that is like at the forefront of their practice. They also have to be prepared for the violence that we're seeing in healthcare and how to keep themselves safe. So when I think about all the things that they need to learn, it seems overwhelming.
Mm-hmm. It's not just about man-phys. It's not just about assessment skills. No. It's really a lot that has to do with mental health and some of the things that even social determinants of health and how that impacts not only well-being, but their physical health as well.
That's another thing that we're introducing the first course. The only other course they're taking is health promotion, and then they're taking this introductory course. And so they had them design a community that would be cognizant of the social determinants of health. Mm-hmm. And it was really cool to see what they included, you know, healthcare, but schools and homeless shelters, and, you know, starting to think like that right from the beginning it's so important.
Well, I think that's the key and the huge like glimmer of hope that I have in our new nursing workforce is they do think about things differently.
They do.
They don't have some of that traditional thought that some of us are steeped in. Mm-hmm. So I say that I'm steeped in it just like everyone else, but they can see through a different set of eyes and they can help us get super innovative. So I love that activity. Yeah. And that is one of those things that just helps us actually just advance and understand through the lens of that patient.
They come to us with, they embrace diversity, and they can teach us a lot about that. So I really admire that about this age group as well.
That's awesome. Mm-hmm. So tell me a little bit more about how you use technology and digital tools to allow nursing students to be better caregivers.
We do a lot in the simulation lab. That is becoming such an important part of nursing education, well, really any healthcare field. And so we really try to make sure that every one of our students gets an opportunity to take care of patients in common situations. Mm-hmm. So everyone gets to take care of a mother giving birth. So the high fidelity simulators are cool. You know, someone in shock. They do a code simulation with the pharmacy students. So we're really trying to do like a lot of interdisciplinary things. But you know what is more powerful than these $150,000 high fidelity simulators is we hire actors to play the role of, for example, one scenario is a patient that has schizophrenia and is hospitalized and is hearing voices and having hallucinations. And so having the students learn how to interact with and communicate, it's really powerful. And another thing that we learn from our graduates is how difficult it is to take care of a patient the first time a patient dies. Mm-hmm. So we have a simulation where they take care of a family during an expected death, and then we do it in an unexpected death because there's such different situations. And so some of those are so powerful. And I think one of the other one that's really powerful is it's an infant simulator and a shaken baby syndrome.
Wow.
And so that comes in with head trauma, but also the parents are there and learning how to interact with parents during that very stressful situation. So we find that if we can help them practice those skills with our guidance, they're going to be better prepared for some of those situations when they get out.
Yeah.
And, lots of stuff that they learn, even some of those simple communications transfer to other situations. It's just like learning how to just meet the patients where they're at and talk at their level and respond with compassion.
It's really amazing. I think what I'm hearing you say is, although technology is an important part of it, it really is the relationships and the scenarios that really build that expertise and build that comfort level so that they can manage in that real life scenario. So I really appreciate the interdisciplinary approach to it. It's super important for all of us to understand the important role that each one of our teammates play. It doesn't matter if we're talking about that hospital scenario, in a rural setting, in a clinic setting, or in even our skilled facilities. So those relationship skills, the learning how to manage and be that leader for the team is really incredibly important. So I appreciate you calling out how much nurses are really looked to as leaders in that patient care.
We're there 24/7, and we're the ones that are interacting with the patient and the family and all the rest of the healthcare team, and making sure that there's that continuity and that high quality. And so that's really important. I think another really creative thing that we do is we have a poverty simulation. Faculty are involved, staff are involved. They play different roles. Someone might be the social worker, someone might be the police officer, and they put the students through these are homeless. And so they're having to figure out some really hard decisions, like, I only have this much money. What am I going to spend it on? Alcohol or groceries, or they can kind of see how people get desperate and do illegal things because it's survival.
Wow. And if you really start to think about it, those are those real life scenarios that they're going to have to work on navigating. When you think about motivational interviewing and really getting to the bottom of what's forcing that patient to not necessarily contribute to their health in the way that's most meaningful. And in some cases, it's survival.
And to understand where they're coming from, what kind of life they've led and the shoes they've walked in. It's like they need to really develop that compassion and empathy.
Yes. And I think in the technologic world, it's building those relationships, which takes time to develop over time if it's not something that naturally comes from you. So I appreciate your emphasis on that. What do you find, or why do you find students today decide to pursue a career in nursing compared to maybe what you had in the past? Maybe it's the same, but I'd love to understand if you've seen any changes or differences in their why.
Our most outstanding students still feel a calling to nursing. They want to help people and they want to make a difference in their lives. And that we see that over and over again in their essays. But, we also see some pragmatic reasons. I mean, because nursing, you'll always have a job no matter where you go. It's so flexible. And the salaries are becoming much more attractive. And I think even the hours are becoming, I think that it's more attractive that way than it used to be. But I think also students realize how many opportunities there are. If you have a BSN in nursing, you can do anything, so that's what they see. And they see that you can work with any age group. You can work in any setting, almost any setting.
Absolutely.
And if you want, you can go on and advance your education and be, an advanced practice provider or a manager, a leader, or come into education. We need welcome to education.
Yes, exactly.
And we have actually a mentor program in our lab skills. So we, once the students have taken the two, we have a beginning skills and an advanced skills course, and they can apply to be a lab mentor. And so they then spend time in the lab with the more junior students. And
it's amazing.
It's powerful because they actually are harder on their peers than the faculty are.
That's great.
And the students are more receptive to their feedback, but a serendipitous finding that we had is they realized they love to teach. So then it's like, we get more students that are interested in nursing education. So
nursing education, being a clinical instructor, to your point, the flexibility and the options are endless. But I think people don't really understand that. They don't. They make assumptions that in all actuality, I have to work here or I have to work there. But obviously, I think you've had a journey, as have I, that I've done a host of different things across my entire career. And in some cases, it wasn't part of the plan.
No,
but
and
those doors open.
Yeah. What other discipline can you do that in? I mean, nursing is really unique in that way. And I think that's what's so attractive about it. We're seeing more men in nursing too. So
absolutely. And I appreciate the way that they think about things and they problem solve differently. So
they do.
I think to your point about diversity and really leveraging some of the different schools of thought, it's really incredibly important as we look to the future and reimagine how we take care of patients across the board. Do you feel like COVID had any changes or motivated people in a different way?
Yes, I don't think it was healthy for them to be isolated, and learning online was not ideal. So, and our students were the first ones to say that they did not like, we saw a lot of mental health issues too. We were only out for half of a semester, thank goodness.
Good for you.
Yeah, but we did see like a decline in motivation, and we're still recovering from that. And, you know, nursing education is cohort-based. So that's what I think makes it so strong, because they get so close and they motivate each other, and they not being close to your cohort during that time was hard. But I do know that when they came back, they were more anxious to get out and practice and help than ever. And especially at the beginning of the pandemic, you know, nurses were seen as heroes and respected. But as the pandemic became more and more prolonged, and we saw this vaccine hesitancy. And I think that that's been a little bit hard too, because all of a sudden some of our patients are skeptical. And as the most trusted and respected profession, that's hard for us to understand. So I'm hoping that that's just a phase, and, you know, we'll be able to reestablish that.
I hope so. I hope so. It's so important. I'll never forget when we started to have some solutions that came onto the market to help us, and just how incredibly relieved people were that we had something that we could do.
Yes.
Instead of just supportive care, the vaccine, monoclonal antibodies.
Oh, I know.
And really, everybody just wants to help. And that calling, that care, as well as really the silver lining of COVID for me was how incredibly connected everyone was as we navigated it, and what problem solving, we could do. So.
They were just so many innovative things. And I honestly think that nurses should partner with engineers and be entrepreneurial, because
I love to hear you say that. So I do believe that we can be data scientists as nurses. I do believe that we have an engineering mindset. And if we partner and help people understand the why behind what we do, as well as the important role that engineers actually play. At Sanford, we actually have some engineers that actually help watch some of our workflows. So again, we talked about how important tradition is to nursing, but how breaking some of those traditions are really what is going to be necessary.
We got to do things smarter.
Yes, exactly.
And it is interesting because, you know, we have engineers big on NDSU campus.
Love it.
You wouldn't believe how many nurses and engineers get married.
Oh, that's so interesting. Now, also, I do have to call out, since you brought up engineering, that Sanford partnered with some of your engineering students to come up with some solutions with different robots that could actually help transport supplies. Again, that efficiency and that effectiveness and that innovative spirit is just so exciting. It's so exciting.
It is. One time we had a group of nursing working with a group of engineer students, because they were going to create some kind of a device to detect seizure activity in infants. But they thought it would be no problem to just insert it in the brain. Well, that would just be fine. So our nursing students had to walk them through this.
What this really means.
Yeah, so they do think differently.
100%. 100%. It's safer if we're working at it together. Fair. So I really appreciate that partnership. Curious from your perspective, Carla, what can we do as an institution that's bringing in and using students for our clinical experience? What can we do to help support that experience more effectively?
Well, honestly, just welcoming the student and make them feel like they're valued. And for us, we kind of coach our students that we don't want them just observing or sitting around. I mean, if you have extra time, you go see if someone needs help. So getting that team spirit right away, ingrained in them. But yeah, I think it's all about creating an environment where they feel welcome, where they feel valued, and they can contribute to what we all want: quality patient care, good outcomes, and a team, a team that enjoys coming to work. And that's what I think we really hope for, is that we work so hard to make sure that our students are practice ready when they graduate. And we just want them to be able to find an environment where they can practice, at the highest level of their scope, and feel like they're valued and feel like they're an important part of the team. Because that's what they want. They're looking for that.
Yeah, when you think about some of our traditional nursing students, that's a very important part of it, is making sure that you have colleagues that you can trust, and that I think all of us know we spend a lot more time working than we do away from work.
Yeah.
And so it's important, and I appreciate how that's elevated for them.
I mean, that becomes your second family, really.
Yeah. Absolutely. I'm curious if you have any questions for me, Carla.
Oh, I think I do. So what is the biggest challenge that you see for nurses in the earliest part of their career?
The biggest challenge, and if I were to name one, I'd say that it's prioritization.
Yeah.
So when we think about the complexity of healthcare and expecting our nurses to really be that leader, there's a lot of stimulation that's coming to them as it relates to especially that inpatient setting. But even in an ambulatory setting, those visits are really quick, and there's a huge set of expectations on the table. So I would say prioritizing that care and making sure that we're constantly looking at the patient as the patient and at the center of everything.
Yes.
It's difficult not to become a taskmaster. But they come to us at their most dire times. Doesn't matter if we're talking about an inpatient setting or the clinic or even in our skilled facilities.
Yeah.
That care, that compassion, that empathy is so essential to really making sure that they have a good experience and that they understand everything that's happening. Again, it takes a lot to manage all the tasks, one.
It does.
But then how do you prioritize that relationship that you have with your patient in that 12-hour day?
Yep. And it's going to take them a while to get there developmentally, because they're so focused. Like we learn, like our nursing students are so focused on tasks right away. And so once we can just get them over that level, then they can see this higher level tasks that not even tasks, responsibilities.
It's the responsibility. It's that critical thinking. I have the privilege to mentor a couple other senior nursing students, and my favorite calls are when they start asking me questions and they're critically thinking through, if I had this super complex patient, help me understand how I would manage. And so sometimes it's really about just giving them that reassurance that it's going to take you some time.
Right.
Use your resources, use those details, and start asking all the questions that you can, because there are resources available around them, and we can just talk through things. So it's so exciting to see how the wheels start turning and how they're starting to try to process through how to do things. So I think our clinical experiences are extremely important. I think our internships are also super intentional and essential for them being well prepared, just to give them that extra experience that they need to be successful.
Yeah, we highly encourage them to do 1 or 2 internships if they can. So I agree. They can have all the technology at their hands that are, available, but they have to trust their own assessment skills and their own gut. Don't ever underestimate how important those are.
I'm not wearing my bracelet today, but it says trust your intuition, right?
Yeah.
So trust your gut.
Yeah.
Makes all the difference in the world. And that gift that a patient, those words that they use, the things that they share with you, what a gift that is to your assessment.
Yeah, absolutely. Because you can't rely on that. Right. I mean, you've still got to know, never underestimate your own assessment skills.
Agreed. I think it's super essential. I think all of us love technology, but I always say we have all these things in place for a reason. If you don't use them or you skip those steps, if it's, again, I think it's up to us as an institution to make sure that we make their work as frictionless as possible. So how do we reduce that documentation burden? How do we make sure that there's value in the work that they're doing? I have a word or a phrase that I always use. It's called gross, get rid of stupid stuff.
Yeah.
So it doesn't matter if I'm talking to the nurses on the floor, if I'm talking to our patient access teams, but what are those things that actually don't add value to your work? And so I think what I would love to hear from our frontline teams, and especially people that come into our institution with fresh eyes, is what are those things that don't make sense?
Yeah.
And if people can't tell you the real why, then gosh, I think we should maybe just look at that and reevaluate, is that adding value to your work and the care that you provide? And if it's not, sometimes we just maintain some traditions because we think we have to. When in all actuality, challenging the norm is what we need to do.
And that was the gift of COVID.
Yes.
That was a bright lining. We learned to do things differently. Anything we can do so that nurses can be present in the moment with patients and families will make a difference.
Absolutely. Absolutely.
So another question I have is, nursing has changed since you entered the field. So what do you tell nurses who are interested in a leadership role like yours?
Oh, that's a really great question. So it has changed a lot. And I came up through the rankings, started as a nurse aide in the Good Samaritan Society near my hometown. So in that long-term care space, was a nurse aide on the pulmonary unit. And at that time, this is what else has changed. There was only one position open and 6 of us that were graduating. Can you imagine?
That was how it was when I graduated.
So I think times were different. When I think about the advice that I give to our frontline teams is, you're a leader every day. You're the lead of that patient care. And so you need to do and you need to learn as much as you possibly can every time you enter the walls and every time you take care of a patient. There's so many things to learn. The other thing that I share with people is don't rush, right? I know that there's always maybe that next best thing that you feel like is going to make a big difference, or it's what you're seeking. Follow your heart, follow your gut, and give yourself time to just learn and grow in the space where you're at. I think, as we mentioned already, nursing is such an incredible field. You can do anything. And so if you think about the opportunities that we have, really to be in our shared governance, so as a senator, to be part of performance improvement and quality improvement, we need the innovative spirit. We need that scientific brain that nurses have to help us solve the healthcare issues of the future. And to that point, we talked a little bit about internships during some of our other conversation. There's actually a lot of other opportunities to actually shadow and spend time with our executive leaders to really understand really what is it and how would I contribute in a positive way to that type. But again, giving yourself time to be in the moment and learn as much as you possibly can seems to be a really important thing for me to share. That if it's okay not to have a goal in the next year, give yourself time to learn. They're
also quick to get to the next step. And it's like, what we try to tell our students is, you can do so much with a BSN degree.
Oh, yes.
And you can make such a difference at the bedside. And there's probably not a more rewarding role than at the bedside with the patients and families. So for some reason or other, this generation thinks they'll have to go on and get an advanced degree. And it's like, no.
You really don't.
You don't.
There's so many things that you can do within the scope of practice of what you have. Like you talked about being a clinical instructor, going back and helping teach courses. There's so much relevancy to the BSN degree. So, awesome.
Yeah.
Awesome.
So what did you tell nursing students, graduates, why they should choose Sanford Health as their place of employment?
Oh my goodness, that's a great question. Thanks for that. I think, Carla, the most important thing that we try to do is differentiate ourselves from other organizations. And I think the 2 ways that we do that is, one, we're on our high reliability journey. And so our culture of safety is at the best that we possibly could. We're constantly looking, we're constantly searching for those ways that we can continue to deliver high quality care without error. So we engage all parts of our organization in quality and safe patient care. Not that everyone doesn't, but I feel like our safe journey, Sanford Accountability for Excellence, has really taken us to that next level. So that's one thing that we're paying attention to at the highest part of our organization. quality patient care, our patient experience, serious safety events, not only for our patients, but how are we actually making sure that our employees feel really safe within our walls. I think the other thing that I am super proud of that Sanford has is our World Clinic program.
Oh, yes.
And so we try really hard to build our mentorships around some of those unique experiences that they'll have the privilege to be a part of. Obviously, we can't have everyone be a part of every program, but I think the opportunity not only to grow as a nurse in different parts of our organization, but also to have some of those other unique experiences.
Have they been traveling?
I'm so excited to share. We actually had we had 6 actually last year that were part of the World Clinic Mentorship Program. Several went to Ghana. We have someone who's just coming back from New Zealand to finish up her experience. So Kelsey is one of our mentors from Brookings. She's actually an ambulatory nurse there and helped with a host of different things around immunization and some of those workflows. Tiffany Johnson was in Ghana and did a lot with education in those teams. Costa Rica is the other location that we've had some teams actually go and spend some time specifically around education, setting up skills labs in Costa Rica. So, and I had the privilege for the first time to travel to Ghana just last month, and it was a life-changing experience.
Yes. Yeah.
The commitment, the love that they have for the communities that they serve is just unbelievable.
At NDSU, nursing before the pandemic was like the second largest study abroad program. We'd gone to Kenya, Malawi, Haiti. We went to India once.
Amazing.
Yeah.
Amazing.
And we're just finally getting back. We're sending a large group of students to Malawi in about less than a month.
Oh, that's amazing. I really do think that it's a differentiator that we learn how fortunate we are in the United States. I think the other piece that, to your point about technology is incredibly important, but the back to basic skills are really even more important than ever. As we look at some of the supply shortages, some of the other challenges that we're having to navigate in healthcare today. And we're going to have to get creative. In Ghana, they call it improvision. And I said, I call it innovation.
Improvision?
Yes.
Oh.
Yeah. Improvise. We improvise. I said, well, I like to call it innovation, right? So let's discover what works, do a lot with a little, and make a difference for patients. So
it's amazing, the things that they get to do and see when they go on those study abroad.
Yeah, it's an eye-opening experience. Well, Carla, it's been an absolute pleasure to get to know you a little bit and have some time to have conversation with you. Thank you so much for joining us today.
Thank you.
You've been listening to Reimagining Rural Health, a podcast series brought to you by Sanford Health. Hear more episodes in this series or other Sanford Health series on Apple, Spotify, and news.sanfordhealth.org. For Sanford Health News, I'm Alan Helgeson, and thank you for listening.